Thank you for joining us for this press conference here at Kent State University in Kent, Ohio today. The university is taking precautions after a new case of Ebola was diagnosed in Dallas, Texas. I'm going to read a statement from the university, offer a few bullet points about what we can tell you about what the university is doing, and then you'll hear from Dr. Warren and Dr. DeJulius. After that time, we'll take a few questions and try to make sure that we can answer as much as we can. The information throughout the country has been evolving throughout the day. Many of you have seen those updates. We've been getting updates as well, so we're going to work with you as best we can to answer as many of your questions as we can. And then when the press conference is over, my media relations team and I will remain behind to help you in any way that we can. I can tell you that Kent State University has now been informed and is now informing the university community that a second confirmed Ebola patient, a nurse who cared for Thomas Eric Duncan, is related to 3 Kent State employees. The patient was not showing any symptoms of the disease when she traveled to Cleveland, Ohio on Friday and then returned to Dallas on Monday. When in Dallas, the patient detected a low-grade fever on Tuesday and entered a Dallas hospital for isolation and treatment. She was diagnosed with Ebola then this morning. Now, it's important to note that this patient, while in Northeast Ohio, did not come to the Kent State campus. Contrary to media reports, this patient was not on the Kent State campus during the time that she was here in Northeast Ohio. She did stay with her family at their home in Summit County. We have been coordinating now with local health authorities, the CDC, and will continue to monitor the situation with them and follow their guidance. Out of an abundance of caution, the 3 employees who are related will now stay home for the next 21 days to self-monitor their health. This is per the CDC protocol. Now, the patient in question here, as you see on your press release, is a graduate of Kent State University, graduating in 2006 and 2008. We will not be releasing the names of the patient or of the names of the employees. Despite what you're seeing in the media, we are not going to be releasing those names, nor will we confirm or offer you other information. It's not appropriate right now. The university remains open. We had to relocate a class from this auditorium so we could host you today, but otherwise there have been no changes to how business is being conducted as usual here. Our media hotline remains open for those with media questions at 330-672-NEWS, which is 6397. Additionally, we have now stood up a hotline for the community, specifically for parents and others that are concerned about what is transpiring here at Kent State. And that number, which you can help us to circulate, is 330-346-4636, which is 330-346-INFO. That is for parents and others that are interested from the community, and we'll have the latest information for them there. We know that you have a lot of questions. We know that you probably want to talk to a lot of our students. We ask you to continue to respect our students as you interact with them. When they do hear things like Ebola, it can cause them to panic. And as I think you'll see from the administration here, we're dealing with this in a very calm manner and dealing with the information to make sure that you folks have what you need. Also, contrary to what you may have seen in some media reports, no one has been quarantined. Again, the 3 employees related to this patient have now been sent home and will be self-monitoring for the next 21 days. With that, I'll invite up Dr. Beverly Warren, University President, to talk about the university's response today. Dr. Warren.
Good afternoon. I thank you for being here. I thank you for your care and concern. First and foremost, our thoughts and our prayers are with the nurse and her family, who are going through a very difficult and trying time with realizing that a family member has been affected by Ebola. So we continue to hold that family in our thoughts. First and foremost, I met with staff in the Office of the President this morning. I met with my cabinet, which are immediate vice presidents within the university, and I met with our President's Advisory Council, which includes all major administrators from department chairs to deans to vice presidents, to really relate to that administrative team where we stand with the information that we know, what we will do to make sure that we keep lines of communication open. Our pledge has been to be as transparent as we possibly can and to try to be as open and forthright with communication when we have it to share. and that would be our pledge to you as well, that we want to be as open as we possibly can about this information and this impact that it has had on our Kent State community. I do want to reassure parents and students, faculty, and everyone in this small Kent community that has become a family, Kent State and the city of Kent, that we were doing everything in our power to ensure safety at first and foremost. That will be our first concern. And then secondly, that we will try to provide information and clarity as we have it. Mr. Mansfield has given the information about the hotlines and the communication lines, and we will post information as we have it. We have instructed our community that the best way to receive that information is to continue to check our website and to continue to make those calls to the numbers that we have provided. We are working with our campus medical team and with the public health department here in the city of Kent. And we are going by the guidelines and great advice that we are receiving from our health professionals, our medical professionals, who are helping us to make those decisions that will keep this community safe, keep this community informed, and keep this community, first and foremost, safe from any harm. At the moment, we do not see that the harm is imminent. We do not see that there is risk of any nature of a level to alarm anyone, and that is the advice we are receiving at the moment, and we will continue to monitor advice as we receive it. I do want you to have the information from our medical team, and I want to yield the microphone to our health director and chief physician here at Kent State University. And Dr. DeJulius will give you an update, and then we'll be available for your questions.
Thank you, Dr. Warren, and thank you for being here. I would like to emphasize the precautions that the university is taking to protect the health and safety of our campus. As you've heard, we've learned that 3 of our employees did have contact with the patient who was subsequently diagnosed with Ebola. However, we know that that patient did not have symptoms while here in Ohio, and we know from CDC that Ebola is not considered to be communicable or contagious until the patient exhibits symptoms. Despite that, we're going above and beyond the CDC's recommendations in asking those 3 employees to stay home away from campus for the 21-day period of self-monitoring per the CDC's protocol. I feel that those precautions put us in a situation where there's very, very low risk to anyone on our campus. At University Health Services, we've been monitoring the Ebola situation for several months in conjunction with our experts at the College of Public Health and our Office of Global Education and others. We do have protocols in place to handle any communicable disease, and we have very specific protocols from the CDC to handle any patient suspected of having Ebola. So I would also like to reassure students that if they feel ill, if they have a fever or other symptoms, please make an appointment and come to the health center so that we can appropriately evaluate them and respond to any concerns. Thanks.
With that, we'll take any questions. Okay.
No one has said whether the 3 individuals who work here, whether they actually came to class on Monday. Has that been sorted out?
We can
What departments do they?
We can tell you the 3 employees did come into contact, obviously, with their relative while she was in town, and that some or all of them, we're still trying to determine, did come to campus because she had not exhibited symptoms. Once they, of course, learned of her illness, they left campus. We would not be providing details on where they went or what times they were on campus and which places, as Dr. DeJulius has mentioned. At the time, she was not showing symptoms, they were not showing symptoms. It's not going to be a detail that's going to provide any clarity.
Do we know when they left Monday?
I don't have the timeline for that. But we can tell you they did come in contact with her, they did visit campus, they did leave campus once they learned of her illness. Well, she went to the hospital with her symptoms yesterday, so they would have been informed then. Once they were informed of her illness, they informed the university leadership. Other questions? Can you tell me who you are and where you're from? Hi, Mark. We won't be providing those additional details that would identify the family members. Wale?
Late Channel 3 News. Do you guys have a concern now, knowing that the three relatives were in contact with her, they were here on campus? I mean, is there a concern on the university's behalf at all?
Dr. DeJulius, can you reiterate what you've shared?
I would just go back to what we know about Ebola and remember that the Kent State employees who were exposed to the patient may be considered to be at some risk, despite the fact that she wasn't showing symptoms. Contacts of those employees are not considered to be at risk. Does that answer your question? Okay.
Okay, yes. Dr. Trina, stay up here.
Can you just clarify the difficulty of actually getting infected? Because it seems like there's confusion as to how close contact you have to be with someone. What does the public need to know about all this?
There's some very good information about that on either the CDC's website or through links on the Kent State website, but essentially the Ebola virus is not an airborne virus. It's transmitted through close contact with blood or other body fluids.
Other questions? Yes. Sure.
Do we know how many people the employees came into contact with while they were?
We don't have details to release on their activities while they were here, but as I've shared, they were in contact with their relative over the weekend. They did report here at some point, and then once they learned of her illness, they left the campus.
To follow up, do you know maybe how much access they would have to the student population?
I can't get into the specifics of which buildings they were in or how long they were here, but if that were, we just don't have that to be able to provide right now. Okay, Dan? Other questions? Yes.
I have been told that the city of Kent employees were informed that she actually attended a KSU football game. Has that been confirmed?
As I've said, she did not come to campus over the weekend. Okay. We can only speak for Kent State, so if you had from the health department, she did not come to campus over the weekend. Shanice?
Are you able to say what positions, if at all, the three employees held or hold here at the university?
We're not going to release that information. Certainly, our thoughts and prayers are with the family, with this nurse as she gets treatment, and the family as well. This is a very difficult time. A lot of you folks are calling these families, so they're going through an awful lot, and that's really where our thoughts and prayers are with them right now. Other questions, Wale?
Just a little more clarity. How can you guys have absolute certainty that she never came through this campus?
We've spoken with her relatives who were with her throughout the weekend, and on several occasions now they've told us she did not come to campus during the time period she was in Ohio. Other questions? Marilyn?
21 days, why 21 days? And do they get paid for those 21 days?
Yeah, they'll be working they'll be working from home. They won't be penalized for that. I'll let Dr. DeJulius address the 21 days.
So they're going to have paid leave then?
We're certainly not going to penalize them while this is going on. So not a concern of ours. Dr. Drew, can you address the 21 days, where that protocol comes from?
The 21-day self-monitoring period is CDC's recommendation, based on the fact that the longest incubation period for Ebola infection has been 21 days.
Is that 21 days from today or yesterday?
21 days from their contact with the patient.
So that'd be 21 days probably from Monday of this.
We're on to day 1, day 2. We'll see how this progresses, Wale. Jimmy, do you have a question?
Yes, I did.
Jimmy Miller, Daily Kent Stater, right? Okay, go ahead, Jimmy.
Do we know for certain that can we know for certain that these employees worked at the main campus, or do they work?
I can tell you they worked at the Kent campus, yes.
Okay. Is there a plan in place to sanitize their desks or any belongings or anything like that?
Would that be necessary right now?
I don't think it's necessary to take those measures at this point. We have a pretty good routine cleaning process here at the university, so I don't think that's necessary.
Other questions? Go ahead.
Tyler Carey, TV2. Given how much Ebola has been in the news recently, how prepared was the administration for something like this? And were you, I don't want to say expecting, but for how long were you possibly anticipating something like this?
So how do we prepare for these kind of things coming to a campus?
Sure. We've been preparing for this since Ebola first hit the news earlier this year. So we are in frequent contact with local public health authorities, and we monitor CDC bulletins regularly and have plans and policies in place for this and other communicable disease.
Go ahead, Adam.
I talked to a couple students, 5 or 6 students. They were a little concerned that they hadn't been sent anything on a flash line. I think it is flash alerts. Have you guys?
Flashline messages were sent out this afternoon. Students should have received them. Those were also replicated through our social media channels. They're on our website. So we've put a lot of information out there. If you get with me afterward, I'll get you a time on the flash line. Other questions? Go ahead. Yes, sir.
Mike Baldwin, Channel 5. When the employees were here on campus, to ask this question, were any other employees notified that maybe they should be checked out or stay home or anything like that?
Dr. Warren met with the cabinet today. She also met with the President's Advisory Council. So the university leadership has been informed, and they have been informing employees as well as other staff and students throughout the day. So we made sure that the community knew just prior to the press release being sent to all of you folks. So go ahead, you have another question?
Students, when I talked with a few of them, they expressed that they are concerned that the holidays are coming up. Their Thanksgiving holiday break, Christmas, etc.
We have homecoming this weekend.
And that this
It's a busy weekend.
and that this is an international campus. And they said what precautions are being done. In addition, they're concerned at how long the virus could live on utensils, etc. And want to know if they're going to go to plastic or what preparations you have for
Well,
the break.
Yeah, I think Dr. Julius has said we're staying in contact with the health department, with the CDC, and we'll continue to follow the experts' guidance. Right now, we haven't been given any guidance that we should go to that extreme or to those routes. Dr. Julius and Dr. Warren both have meetings to go to. I will remain here with the media relations team. Are there any last questions for them before we can excuse them, please? Shanice.
I have been here before. So do you know if the patient was she allowed to travel?
That wouldn't be a question for us, Shanice. Anybody questions for Dr. Warren about the university response? Dan?
For Dr. DeJulius, I think I want to follow up on, if you could explain maybe how long the virus lives on, say, a hair or something inanimate like utensil. I've heard it's not very long, so it's only really direct contact with the fluid. You can't really catch it secondhand. Is that correct?
Correct. It can survive in fluid on a surface for a number of hours, but on a dry surface, it does not have a long survival. Yeah, it would degrade.
Okay, we're going to thank Dr. Warren and Dr. DeJulius, who have to go to other events. I'll continue to take some of your questions. I'll let you know throughout the evening this media center will remain open. If there were a need to provide a media update, we'll come back into this room with notice and make sure that you know that. Other questions? Wale?
Speaking with the three relatives, two parts. Were you able to tell us how long they were on this campus?
I don't have those details for you. But we can confirm they came to campus. When they learned of her illness, they left the campus.
And also, were you able to find out if they had any kind of open sores or open wounds?
I wouldn't have that level of detail, but we were not aware of any symptoms with the relatives while they were here. And has been reported, the patient, while she was in Northeast Ohio, showed no symptoms. Behind? When the relatives were notified from Dallas that their relative had gone in and become ill and was diagnosed, they immediately notified the university leadership. Remember, she wasn't diagnosed with Ebola till this morning. As far as date and time, I don't have the date and time that the relatives told the university. I know that we were notified this morning. My office was notified this morning. by Dr. Warren's office.
You said the employees notified?
The employee who's sick in Dallas, when her relatives were notified, those employees here notified the university leadership and then departed campus. I don't know if it was last night or this morning. Remember, based on the timeline, she went into Dallas yesterday with symptoms, but was not diagnosed with Ebola until this morning. Okay? And I'll try to help you as much as we can. Remember, it's been a very evolving story, and we're trying to help. Go ahead.
Danielle will jump you off that today. I apologize, I came in a little bit late, but have you guys been trying to identify who those 3 relatives may have come in contact with on campus?
We're working with the CDC and following their guidance. Dr. DeJulius, our university health physician, just addressed that based on the level of risk and what steps we need to take when someone comes in contact with someone who at the time did not exhibit those symptoms. And we haven't been given that level of guidance that we're supposed to go out and track those folks. If we do receive updates from the CDC, we will share those with the community. It's very important.
Were all 3 relatives on campus after being in contact with?
I don't know if all 3 of them were, so I don't want to speak out of turn, but we do know that some of the relatives did come to work as planned because they weren't sick and neither was she at the time. But once they learned of her sickness and the level of her sickness, they left the campus. A question over here, yes?
Megan Wilkinson with the Vindicator. I was wondering, obviously the patient was not at Kent State at all,
According to her relatives who spent the weekend with her, she did not come to campus.
do you know where she stayed over the weekend?
That would be a question for them. I just don't know. I just don't know. Other questions? Her family lives in Summit County. That's all we're able to say. Dawn, do you have a question? No? Yes, go ahead, Katie.
I was wondering, are these recent events going to impact the homecoming activities at all?
As of right now, no. Campus remains open. Campus activities remain scheduled. And again, we're following what the CDC has shown us for guidance, and we'll continue to do that. Last question. Go ahead.
I had asked about a football game. Was that football game here on campus or was that football game somewhere else?
We have a football game coming up this coming weekend on campus because it's homecoming.
I was talking about the last one where they said she had attended one over while she was here. There was a home football game this past weekend.
Right.
She did not.
She did not. And as much as you can help us to clarify those points of whether or not she came to campus, which she did not, whether we have people quarantined, which we do not, will certainly help get the correct information out, but also keep our students and their families from undue panic. So we ask that you continue to try to work with us on making sure that we have clear information. I'll remind you of our media hotline, which will be open throughout the evening, 330-672-NEWS, and our community hotline for parents and non-media who have questions at 330-346-4636. Media relations team will be around for a while. If you have other questions, we'll try to help you. If there are updates, they will come from my office, and if there are press briefings, they'll be done from this podium. Thank you, everyone, for your time and your help today.